Welcome everyone to MEI lab. In this lab, we are going to learn about how to acquire the electrocardiogram signals. The electrocardiogram signals are the recording of the electrical activity that is generated by your heart on the surface of your body using some electrodes. These ECG signals help the clinician, doctors, and researchers to find out any abnormality and the pattern of the working of heart. A sample ECG signal or ECG beat is shown in this slide, and it is divided into, not divided, it consists of a number of waves, segments, and interval that are P wave, then T wave, QRS complex, PR segment, ST segment, PR interval, and QT interval. So how these waves, intervals, and complex are generated? The ECG starts in the sinoatrial nodes, which is also known as the SA node, that is located in the right atrium of your heart. As we all know that the heart is divided into 4 chambers. The upper 2 chambers are called atrium and the lower 2 chambers are called ventricles. So the SA node is located in your right atrium and it acts as a pacemaker of the heart. That is, it generates those electrical impulses and initiate the functioning of the heart. The electrical signals that is generated in the SA node causes a atrial contraction that forces blood to flow into the ventricles, and this sequence is recorded as the P wave. Then the signal passes from the atria to ventricle and causes a contraction of the ventricle that resulted in the pumping of blood to the rest of the body. This whole process is recorded as the QRS complex, and finally the ventricle relaxes and it is recorded as the T wave. So between these events there is a very small fraction of time where it rests, or from one contraction to other contraction or relaxation, there is a little a small amount of time where no contraction or relaxation occur, and that is represented as somehow a straight line, and that is, those straight lines are called the intervals. So these are the basic of a ECG signals. I'm sure you have learned in details in the classroom. So my motto was just to give a brief introduction to the wave or a single ECG beat. However, the main focus of this lab is to involve you in recording or to let you know how to acquire a good ECG signal. So for that, there are certain rules, you can say, or some key points that you need to remember and always keep in mind while doing your recording. The first and most important point is getting the proper training before recording. There are many important things involved that may lead to a noisy or a bad quality ECG signals. That is the proper placement of the electrodes, where the electrodes must be placed, then how the area of the electrode placement must be maintained before attaching the electrode to your body, then how you should operate the system or instrument that you are going to use for the recording. So before doing your recording or taking the recording from the patient, you must get a proper training and a proper idea of all the instrument or the procedure involved in this process. The second most important thing is to make comfortable the patient, because most of the cases, while we listen about some experimental procedure or some clinical procedure, we get panic, or a visualize come to our mind that there must be some seizure and some injection, some operation, and it may uh, initiate stress. So before doing your recording, you must give a brief introduction of yourself, that who are you and what is your role in the whole process. Then explain the procedure to the volunteer or the patient involved, that how the recording to be done and what are the process or procedure you will be followed and what are the steps. And for ECG recording, ensure that this is not a painful process, because there is no needle or some seizure is involved in this case. So it is purely painless process. So just assure this thing to your volunteer or patient. The third most important point is, after explaining all these things, you should take the permission from the patient. And in clinical, you no need to take a written permission. It must be verbal. But while we are dealing with some experimental or research-based procedure, it is always preferable to take the written consent from the volunteer. The consent of the volunteer is the proof that he or she is voluntarily willingness to participate in your study, and there is no uh, there is no um, I mean you are not forcing them to be your volunteer. And start the recording when your patient is comfortable and relaxed. Wait for some time to get your volunteer comfortable, and then you can start your procedure once he or she is completely ready. So as I was talking about the consent of the volunteer, there is a uh, standard written way to take this permission, and a sample consent form must contain these three parts. That is the information sheet. The second part is the information related to the volunteer, and third part is certificate of the consent. So what the information sheet contain? It contain the introduction of your experimental process. I'm just telling the consent form in a research perspective. It is not in a clinical perspective. So while you are taking an ECG for research purposes, this information must be there in your consent form, and it is based on the WHO guidelines that involves animal or human study. So it contains the introduction. Then the second part is the purpose of the research and description of the process. What are the process involved in your research? Then you have to make them understood, their voluntary participation, the duration of the research, then the risks and benefit if there is anything involved in the whole process, the reimbursement, then confidentiality and sharing of the result, then right to refuse or withdraw, and whom to contact. So confidentiality and sharing is what the information of the volunteer is always confidential. It must not be disclosed to other person. To maintain this confidentiality, what you can do, you can take a patient ID for each patient, and the information related to the patient ID and the respective patient name is only known to you, not not to anyone. In that way you can maintain the confidentiality. And then right to refuse or withdraw is you are assuring your patient that at any moment of the experimental procedure they can refuse or withdraw their participation if they feel so. Then whom to contact if anything, if they need to know more or they need to have any query or any complaint, then whom to contact. Then the second part is the information related to volunteer. These are the general information, and it involved the uh, name, age, sex, and of the patient. You can take BMI also. Then the medical information, if any, if they have gone through some surgery or they have some chronic diseases, then medical history, if any. Then habitual information. The habitual information are mostly related to their food habit or their consumption of any drug or alcohol. Then the third part is a certificate of consent. It involved both the undertaking by the volunteer and the undertaking of the witness if there is a illiterate patient who don't know how to read or write. Then the statement by the researcher. So let me show you a sample consent form prepared by one of our researchers. So it contains, as we have discussed, a standard consent form normally usually contain three parts. The first part is the information sheet that contain the researcher name, then organization name, the introduction to the research, then the purpose of the research, then type of research intervention and description of the process, then voluntary participation, then duration of the research, risk and benefit, if any, then reimbursement if it is a funded project, then the volunteers taken part are given some incentive. If it is not, then uh, in some of the cases no budget provision was there for the reimbursement of the volunteer, sorry, to the volunteer. Then confidentiality statement, then sharing of the result, then right to refuse or withdraw as I have already discussed, then who to contact. Then the second part is the information related to the volunteer. It contains the general information, then name, date of birth, age, address, contact number, email, BMI, then medical information for the if they have taken any medicine, then sleeping disorder, then appetite, medical history, surgical history, drug history, This medical information is somehow will related to the type of work you are involving, and it may vary from one research to the another. So those information that is uh, required for a detailed analysis of your project, you can only focus on those information also. Then habitual information, smoking and alcohol consumption or habituation information, and any other comments. In this case, you can add some special cases uh, or any additional information except that is been listed above. Then you can take note of those information also. Then part 3, the certificate of the consent, the statement by the participant, then the statement by the researcher or the person taking the consent. Now let's move to the next section, that is the place of recording. In the earlier cases, we know about the participant and what are the important factor or information you should provide or collect from a participant before recording. So place of information, the place or the room you are using for the recording of your ECG signal must be comfortable. The second is it must be private and safety. It must be noise free so that the environmental or external noise should not hamper your recording. And the fourth most important part, it must be clean and with a good hygiene. The privacy and safety is important because in most of the cases, while you are dealing with a 12 lead ECG, it is the recording required to unclothe your upper body part because the electrodes are placed on your chest area. So that's why, to make the volunteer more comfortable in doing that, we need a private a room that is of much privacy. Then you must ensure the connection are in their proper places. The electrodes, those you are using, must be of same type. Then ensure the connection of the wires or USB cable if any, and then the frequency setting. The upper and lower frequency cutoff must be maintained for your recording. It is most of the cases it is 0.05 Hz to 250 Hz for for child or children, and it is 0.05 to 150 Hz for an adult. We generally maintain this frequency range of the child. That is, if it is beyond 250, then there is no harm in that also. But it must not be less than 150. Then infection control. How you can control the spreading of infection of virus and bacteria. So this can be done by washing your hand before and after contact with the patient. It is a important step for both the operator and the participant, because while putting the electrodes, you both come in on physical contact with each other. Then the operator can use a personal protective like hand gloves, since this is the time of COVID, you must, if you are taking a data in this period, you must have a protective mask on your face. Then use of razor. In some of the cases, while there is body hair, you need to remove body hair. Then it will, if you are using a razor for that purpose, then you must use a single razor for a single participant to avoid the infection of HIV. Then the next step is the skin preparation. Before placing the electrodes on the body surface, you need to prepare the skin to lower the skin contact impedance. So how you can do that? You must wash the electrode placement area with soap or alcohol. Then if there is body hair, it must be removed with a razor or a trimmer. Then in between your skin and the electrode, an electrode gel must be used to reduce the resistance. The patient information I have already discussed in the consent form. It must contain the age, sex, name, then address, then contact information of the patient. Then a patient ID must be assigned to every patient. Then date and time of recurring must be noted, and the additional information if any. So now come to the ECG acquisition system. There is two types of ECG acquisition system: single lead system and 12 lead system. The ECG is usually recorded using some standard differential recording between 2 points, and this differential recording this is the differential recording means you are just calculating the potential difference between these two in 2 points. So each differential recording is referred as a lead, but the points that you are using for the recording must not be random. There is certain standard where you should choose those points, and for a single lead it is decided by Inthoven, and it is also called as Inthoven triangle, and it defines 3 leads with the Roman numerals 1, 2, 3. So before going to that, let me show you a image. So this is a single lead image acquisition. This is the representation of the placement of limb electrodes during the single lead ECG acquisitions. So the electrodes are placed on your arm and on your legs. So if you are putting those electrodes on the thigh, then the upper arm electrodes are placed on the shoulder. If you are using your ankle, then the electrodes must be placed on the wrist. So here these 4 electrodes are named as right arm, right leg and left leg. The image was adapted from the link given below under the CCO license. So just remember this abbreviation because we are going to use that for the lead value. So your lead 1 is equal to VLA minus VRA. That is the potential difference between left arm and right arm. Similarly, lead 2 is the potential difference between left leg and right arm, and lead 3 is the potential difference between left leg and left arm. We have already, I guess you have already studied these things in your theory classes. I'm just giving a brief introduction on this. So these leads are not independent and they follow a relationship, that is the lead 2 must always equal to lead 1 plus lead 3. So if you add lead 1 and lead 3, you can see VLA minus VRA plus VLL minus VLA. So here VLA got cancelled and the what remain is VLL minus VRA, which is the value of lead 2. And your right leg acts as your reference point. So the single lead system consists of 4 electrodes, and where the measurement are, and you get 3 measurement, that is lead 1, lead 2 and lead 3. So this is the example, or not example, this is a demonstration. This is a picture that we have taken during the acquisition of a single lead ECG, and you can see here the patient is in the sitting position. In most of the cases we use the patient are in rest condition on a bed, and it must be in a 45-degree angle. If you are taking the ECG in some other position, then you must mention that during your recording. Now come to the 12-lead ECG acquisition. In single lead ECG, we use 4 electrodes and we get 3 lead. In 12-lead ECG system, we use 10 electrodes and we get 12 lead. And in this system, the leads are broadly divided into 2 parts, that is based on the horizontal plane and vertical plane. The vertical plane leads are 1 to 3, as we have calculated in lead single lead system, and then 3 augmented lead. The augmented lead are measured using these 3 lead through a formula you must have known from your theory classes. And the horizontal leads are also known as the chest lead, and it is represented as V1, V2, V3, V4, V5, V6. So this is a pictorial representation of these 12 ECG leads in the horizontal and in the vertical position, taken from the given link under the CCO license. Here is the representation of the 3 limb leads and 3 augmented leads. That is 1, 2, 3, and AVF, AVL, and AVR. The value of AVF is equal to VLL minus half of VRA plus VLA. Similarly, the value of AVL is equal to VLA minus half of VRA plus VLL. And the value of AVR is equal to VRA minus half of VLA plus VLL. So as I have told, in 12-lead ECG acquisition system, we take 6 extra electrode. Those are placed on the chest area. However, the placement of these electrodes follow certain rules, and there is some exact or specific point where you should place those electrodes. The V1 and V2 are placed on the left and right side of your sternum at your fourth intercostal space. What is the intercostal space? It is the space between two ribs. Calculate the number of ribs from your neck. You can easily can feel there is a space between two successive ribs. So you can just measure which is the fourth space, and then you can place two electrodes, that is V1 and V2, on each side near the sternum as shown in this figure. The V4 must be placed in the fifth intercostal space, and in between V2 and V4, V3 is placed, and V5 and V6 are placed in the sixth intercostal space as shown in this figure. So this is a picture that has been taken during the 12-lead ECG acquisition. You can just see the placement of these electrodes, and there is 6 chest electrode, though it is not clearly visible. We can see only 4 or 5, but there is another in the left side that is not visible in this picture. But overall you can see we have placed 6 electrode on the chest and then 4 electrode on the 4 limbs. So after placing those electrode, it's time to take the recording. Since we are not following a classroom class due to this pandemic, it is not possible to give you people a demonstration as we are all at our home. So what I can do is I've just make you understood how to place those electrodes, and then let me tell you something about the ECG acquisition system or the software that we are using, so you can have an idea after placing the electrode how you can record those information. While you will be returned back to the campus, we will definitely arrange a special lab or a demonstration for this ECG acquisition, where you in that time you can have a better exposure and you can gain more knowledge in detail. So let's move to the ECG acquisition software that we are using, and let me show you how it is operating. So this is the software we are using for the acquisition of ECG signal. It contains 3 sections: the acquisition section, the review section, and the analysis section. Since the cables and wires are not connected, I can't show you the real-time recording, but I can show you the interface. So while clicking on the acquisition, it will ask for the patient information, where we have to put the we have to give the patient ID, then the patient name, date of birth, and all required information in as you can see in the interface. After that, you will click on OK. So let me give a patient ID 1, then name some Mr. X maybe, and I'm not filling of all this information. I'm just let you know how to use this software. So let me just click on OK. So after clicking on OK, you will find out this interface where it is lead 1. So if you want to see a 12 lead system, you have to go to view, then you can click on 12 lead or 6 lead, single lead or 3 lead. So before taking your recording, you can configure these values or these you can set these values like high pass cutoff frequency, low pass cutoff frequency, then the notch filter, then gain and sweep. Then in the display, here are some setting for the display. Then you can print these values, then you can generate this report, and this is the report that is produced, the setting for this, whether you are going to print a 12 lead system or a 6 into 2 lead system or 6 frontal. You can choose according to your requirement. Then you will click on OK. So after that, for store, when you click on store, the ECG will be recorded, and if you want to freeze off or stop, then you can stop here, and to exit from the system you can click on exit. Let me go to the second section, that is the analysis section. Here in the load section, you can load the data of any patient that has been stored in your system. So right now only the demonstration patient is stored here, so I am using this demonstration, the demo patient. So in the median, then variation, then interpret. In the interpretation section, it will give you the report based on your acquired ECG. It will give the values of this parameter, that is average heart rate variation, RR interval, P wave, then P duration, QRS width, QRS and T axis. All this information will be available with your report. Then you can also show whether any abnormality is found during the recording, or you can print these files, or you can exit from it. So this was all about how to acquire a 12 lead ECG. This is mainly the process of acquisition, but when you will have a real-time demonstration, you will know more later, and we will arrange a demonstration class for this after the college reopen. Thank you.